Hi, I'm Dr. Chad Larson. We're going to continue our series on nutrients and the importance of knowing about certain nutrients, why they're important, and why they're oftentimes overlooked in the standard medical system. Nutrition and things like micronutrients, vitamins, minerals are really just not taught in standard medical schools, and what's more emphasized are things like prescription medications. So as those become more and more mainstream, as they are, I think it raises the importance of continuing to discuss micronutrients and the importance of basic nutrition. Because oftentimes when certain pharmaceuticals are prescribed, it could be just because a person actually has a nutrient deficiency. So we've talked about a few nutrients already in this series, and today we're going to talk about a few nutrients as a group, which is B complex or B vitamins. And you've probably heard of multiple B vitamins like B12. There's also B1 and B2 and B3, and they have other more technical names like thiamine and riboflavin and niacin and cobalamin. And so these are B vitamins, and they have so many uses in the body. And they're a finite nutrient, meaning there's only so much B vitamin that's in the system, and if we're not repleting it regularly or replenishing those levels regularly, then we can very easily become deficient or at least insufficient. And so I test B vitamins levels frequently on patients, and I find them below the optimal levels almost all the time if they're not already on a specific diet that supports B vitamin levels or already on a B complex supplement or a high quality multivitamin that includes the B complex vitamins. So and then actually many times I find people actually frankly deficient, where they're actually below reference range, not just below optimal range, but actually below reference range. And sometimes we can see this just in really standard blood work, like looking at your CBC, your complete blood count. This is where we have red blood cells and white blood cells. Oftentimes, red blood cells, when they're low, we think, okay, they're anemic, which they are if the red blood cells are low, but most people assume that that is iron anemic. In other words, low iron leading to low red blood cells. And what we see pretty frequently is that B vitamins could actually be what is causing the low red blood cells. And by looking at a couple other markers on standard lab work, standard CBC, looking at the MCV, which is the mean corpuscular volume, and the MCH, mean corpuscular hemoglobin, these could let us know, is it iron or is it B vitamins? Because if those values are low, that does indicate low iron. It's likely to be an iron deficiency type anemia. But if those values are elevated out of range, it's B vitamins. And I'm struck by how many times people bring me their lab work from other providers and they're told that everything looks fine. I look at it and they're anemic, and they're anemic with one of these B vitamins. And so we have to just very easily put them on good solid levels of these B vitamins. Sometimes we're doing B vitamin injections. Sometimes we're doing supplements. We're doing things with their diet to help boost up their intake of dietary B vitamins. So there's a variety of things that we can do. But what do these B vitamins do in the system? They do so many things. They're so important for building blocks for your neurotransmitters. Neurotransmitters are like the biochemicals in the brain, the chemical messengers in the brain, and they require B vitamins like vitamin B6 and B12 and folate for their production. And if these things are insufficient, then guess what? They're gonna influence your body's ability to synthesize these neurotransmitters. And these neurotransmitters have names like serotonin, which I'm sure you've heard of, and GABA, and dopamine. And so oftentimes people can get mood disorders just because they have B vitamin deficiencies. They can have cognitive issues, they can have memory issues. In a more severe kind of situation, they can have neurodegeneration or breakdown or deterioration of your neurons. And this could lead to some chronic neurological conditions. And all they really needed was B vitamins. And so they're very often insufficient and very often overlooked in kind of standard, primary care kind of medicine. Some other things that B vitamins do is they're involved in liver detoxification. They're involved in the health of the cardiovascular system. They're important to balance something that we look at on every patient that we run lab work on called homocysteine. Homocysteine is sort of a proxy for us evaluating your methylation. Methylation being an important sort of enzymatic process in the body that we've had other episodes just on methylation. It's a very key process in the body, but it requires B12 and folic acid and B6, some very important B vitamins for methylation to keep humming along. And as your methylation drops down, your homocysteine levels go up. And so we can very easily test this with a basic blood test looking at homocysteine levels. This is another way that we can peer into your body's needs and requirements of B vitamins. And so cardiovascular system, homocysteine we know is kind of an abrasive, kind of an inflammatory substance in your circulatory system. And so if you have elevated homocysteine levels, then that could increase certain kind of inflammatory processes in the bloodstream, which could influence the health of your blood vessel walls. So having these normal is really vital. And again, good old simple B vitamins, which really help to dictate this. Another thing is energy levels. B vitamins are very important for energy levels. In fact, even if we take the extreme example that we talked about, somebody is fully anemic, we know that when red blood cells drop down, the number one symptom that people have is anemia, is fatigue. And so fatigue is caused by low red blood cells because red blood cells help to deliver oxygen all over the body. And if oxygen levels are not able to reach things like the brain at maximum levels, then that will influence energy production in the brain. So fatigue and energy issues are really common if B vitamin levels are off. So those are some of the things that B vitamins do. They're so key to just general health. And that's why we test it from multiple different angles to really take out the guesswork, and we could be much more of a sharpshooter with how we recommend certain clinical changes for people with B vitamin deficiencies and insufficiencies. And so where can we get these? Obviously, like we talked about, you can get them in supplements. And, you know, like we've talked about many times before, is that the quality of the supplements really matter. And for the most part, we want high quality, specific types of B vitamins, especially when it comes to folate or folic acid and vitamin B12. We typically want these methylated. So we want methyl B12 and methyl folate because it's the methylated form that is usually more usable by most people. And there's other nutrients that also can be in these sort of activated forms. So we want activated B vitamins so the body doesn't have to really work too hard on processing these nutrients in your system. In our office, if somebody is low enough B vitamins, then we sometimes will use nutrient shots. So it completely bypasses the GI tract and just gets right into the system. So sometimes we'll do that. Sometimes we'll use nutrient IVs, so we can actually introduce these nutrients right in the circulatory system directly. So there's a variety of ways that you can get this, but diet obviously is a key place too. So we can get B vitamins from basically a healthy diet, a healthy anti-inflammatory diet. B vitamins are all over in things like leafy greens and other vegetables. We can get B vitamins even from animal proteins. We can get B vitamins from nuts and seeds. So it's basically just following a good, healthy diet. You know, as typical, we typically recommend, organic and high quality sources of these foods, and they seem to be higher in these micronutrient levels like B vitamins. So B vitamins are absolutely vital for general health, and it's something that I encourage you to have tested. Take some of the guesswork out, look at things like your CBC, have your provider look at specific B vitamin levels so that we can really understand where you start off at, and we can make the proper changes so that you could maximize these things like brain health, mood, energy. It's great, B vitamins, I didn't really mention before, are key for your hair, skin, and nails. So there's hardly an organ system that B vitamins don't touch and influence in some way. So this is the next nutrient in our series on educating you about the importance of these micronutrients. So because let me give you a quick example. So sometimes people are prescribed, let's say they have depression or they have anxiety, and they're oftentimes put on an antidepressant medication. But you know what? Maybe their neurotransmitters are insufficient like serotonin because they simply need certain B vitamins. I've seen this clinically before, and it's oftentimes we can just give B vitamins in these certain situations, and their mood improves. So that's just one example of many that that you can think about. But so if you have anxiety, depression, or you have some of these cardiovascular risks, energy issues, have a look at B vitamins first before you start before your doctor prescribes a medication. So find a provider that can look at these levels this way and help take the guesswork out. So I'll keep reading the studies and bringing you the information. Until then, keep it real.